Many a times, parents come to me with few questions like, my child is looking pale, what do I do? Is my child iron deficient? Should I start an iron supplements for him? I am Dr. Srikanth Marda, Pediatric Hematologist and Oncologist from Ankura Hospital, Hyderabad. In today's video, I would like to emphasize on one of the global health problems, which is anemia. So what is anemia? What causes it? In simple terms to tell, anemia is a condition where there is deficiency of red blood cells or the hemoglobin concentration in the RBCs. 30% of the world's population is suffering from anemia. Where we are able to get victory over many other things, anemia is on the other side of the coin. According to the National Family Health Survey 5, the prevalence of anemia in 6 to 60 months of age in India has risen from 57% to 65%. That means amongst 100 children, 65 children are anemic. That itself intensifies how major the problem is. So what are the risk factors for anemia? Firstly, it is improper breastfeeding practices. That is, exclusive breastfeeding has to be done for 6 months of age. And later, the transition where it comes at 6 months where complementary foods have to be started, it has to be done under a proper way and in a channelized way. Other important thing is, many times parents emphasize on animal milk as the chief source of diet, which is definitely a wrong concept. And the growing children definitely needs the micronutrients, elements and vitamins in a higher amount. So there is always a mismatch between the body's supply and the demand. So this discrepancy always leads to a deficiency, and the food which they are taking is many times deficient in majority of the minerals and vitamins. Some other rare problems like bleeding disorders or genetic problems or blood loss can also lead to anemia. So how do we go about it? So is iron needed only for improvement of hemoglobin in the body? The answer is no. Iron is a key element which is needed even for the brain growth, for the synapse formation and for the myelination as well. And majority of the brain growth is completed by 3 years of age. So if this golden period is missed, there are chances that the child can have IQ also which can be slightly on a lower side compared to the other children. Apart from that, iron is as well needed to strengthen the immune system, so that the child can fight against the infections in a better way, improve his bone strength as well, and for the routine growth and development milestones attainment. So what are the foods which can be inculcated, or what is the diet which can be followed? So generally what we advise is an anti-anemia platter. So that is like a colorful balanced diet which is known as the Indradhanush diet, that is including all forms of colored things in your diet. So for example, including the greens like spinach, amaranth leaves, moringa leaves, curry leaves, then other vegetables like potato, beetroot, carrot, radish, turnips, fruits like pomegranate, guava, apple, and millets like ragi, bajra, jawar, inclusion of jaggery into the routine diet, and non-vegetarian sources of foods like meat, fish, poultry, inclusion of dry fruits into the child's diet. So all this accounts to what is known as an Indradhanush diet. A poor nutrition will always lead to a poor health. So simple measures of following a healthy food habits and eat which is right to the baby, give which is right for the child. Regular deworming, that is every 6 monthly, and prophylactic usage of iron and folic acid supplementation. So these would be the golden steps for achieving an anemia mukt Bharat. So creating awareness about the problem would start right from you. So for more information related to anemia per se, contact your pediatric hematologist as early as possible. Thank you.